Back with you tonight here on In Focus, and thanks for staying on. Doctors in the Eastern Cape have called on the Provincial Health Department to declare crisis and open up to the public about the poor state of services in the healthcare system there. They have warned that state hospitals are facing total collapse. Daily Maverick reports that the crippling staff shortages, broken equipment, basic drug stockouts, emergency surgery delays, a specialist doctor brain drain are among the key issues leading doctors to resign in their numbers. Joining us now to explain how the province is dealing with the crisis is Dr. Mtandeki, Xamlashe, Eastern Cape Health Medical Services Director. Dr. Xamlashe, good evening, and thank you very much for your time and for joining us tonight here on In Focus. My understanding is that these are 3 hospitals in the province, the hospitals in Gqeberha, Livingston Hospital, Port Elizabeth Provincial Hospital, and Doranginza Hospital, all forming part of what we are talking about when we talk about the Livingston tertiary hospitals. Is it true that these particular joint hospitals in the province are seeing at least a drain of about 2.5 million people coming out of the health system in that province? And does that have enough specialists to provide for the area of about 7 million people?
Yeah, good evening, Thabo, and good evening to the listeners. And it's Mtandeki here. As you have already said, I'm talking to you from Gqeberha, the Nelson Mandela district. True, Thabo, that we are having constraints. What we don't have is a collapse. Our hospitals are not collapsing. Our hospitals are severely constrained. Going back 6 to 7 months, one of the things that the citizens must remember is that Gqeberha was the epicenter of the COVID pandemic in Eastern Cape. A lot of damage happened to these facilities, to systems, to resources, and to other services that were planned in general, including planned surgeries and other services offered to the public.
Right.
So when the COVID pandemic hit in this province, it hit this part of the province the hardest. It caused maximum damage to this part. We may be forgetful if we forget that, because it was covered by the media very well, including Newzroom Afrika. So that damage was severe, and we are putting together a recovery plan, which is supported by Treasury, by our Premier, by our MEC, and our head office. We are in that recovery mode. It's not going to be short, it's not going to be overnight, it's going to take time. So we do agree there are certain constraints and there are certain incidents that are actually testimony to those constraints.
Yeah. But you're saying this is not an unprecedented crisis compared to the one that you saw in 2020. But there is a sense that you are moving from one crisis management to another, and therefore you are unable to prioritize key areas that have been affected. For example, nursing shortages, resulting in less time for observation, medicine administration, and patient care really dilapidating, to the point where doctors are saying patients are dying waiting on ICU beds.
Certainly, Thabo, I was not here to rebut any views of certain citizens based on their experience observation. But I'm informing you from a point of knowledge and authority in respect of these matters. So that is not true. There is no such existence. You come with your video cameras or your crew tomorrow, definitely you're not going to see that. Our hospitals are functioning, but under very difficult circumstances. We're still doing open heart surgery. We're still dialyzing patients. We are operating in orthopedics. We have long slates as we had even before COVID. They became worse during the COVID. So definitely, people are going to lose patients, so they've added another year to their waiting for a hip replacement. Certainly, priorities do not start in tertiary hospitals. The biggest priority of this health system is to keep the citizens healthy. The hospitals are there to intervene when there are disasters. That's one aspect. Number 2, the constraint is not just financial, it's also the burden of disease in this particular part of the province or the country. this is one area where trauma is highest in this province, in the Nelson Mandela Bay. So the patients that are waiting for planned operations are quite overtaken or unfortunately are put behind on the list when the emergencies come in. We have a lot of trauma here, and issue of prioritization probably in the context in which you have said is certainly inaccurate. Emergencies and traumas are always a priority, and unfortunately we have no control in respect of that. You talk about gunshots, you talk about interpersonal violence here. You are talking about motor vehicle accidents. You come to our A&E or emergency department on a Friday, whatever you would have planned the following Monday to do in your theater would have to be postponed in favor of those emergencies.
Yeah.
So we're also having a problem of a high burden of emergency cases, especially in your surgical departments, which results in people having to wait longer for what is considered a planned operation, like replacing a knee or replacing a hip or fixing an elbow that is as a result of arthritis. But the one that is as a result of trauma has to be a priority. So it's not really a question of first come, first served in our situation. Emergencies always get the first priority. There is no nursing shortages in our staff. We've got a lot of support from the head office in the area of replacement of nurses. Doranginza, although I don't work there, they just recruited about 80 nurses to replace 30 nurses that they lost during the COVID. So they got an extra 50. Their services are continuing. Livingston, our vacancy rate in the nursing category is less than 10%.
So they're saying, are you saying to us you have managed to replace all the nurses that have died during COVID and those that have resigned, and many of them being highly skilled and experienced and trained? Many are reported to be suffering from post-traumatic stress disorder after the COVID-19 pandemic. They're saying few here have actually been replaced.
Certainly. Look, replacing is not the only answer to what we are going through. When we talk about the recovery plan, it's not just about filling the posts of people. It's also trying to heal the staff that were psychotraumatized by the COVID pandemic. So people were damaged emotionally, people are damaged psychologically. I'm talking about the staff that did not leave. So that's our first priority in terms of everything that we do. You will see us on Friday, the media is going to cover. We have a big function where we'll be actually having these kinds of healing services and staff appreciation events this Friday evening. It will be covered live by media. So the first priority is not just commodities. The first priority is people. My workforce must recover. Those who did not resign, who are still here, they must get my maximum attention. They need to go through some kind of healing, because they were damaged. To them, COVID was not a virus. It was emotional harm. It was psychological damage. And through some, people were broken spiritually because of what they saw. You will remember, Thabo, I'm talking about the workforce that had to leave home and go to work when everyone was told to stay away and stay at home.
Right.
So they are definitely damaged, and they are my priority number one. Yeah. The linen and the papers in the yards and everything else are an important priority, but they're not more important than my workforce. So that the patients can get better care, they can get safe care from my workforce.
Dr. Xamlashe, are you hostile towards the specialists who are raising these issues with you? They seem to feel like they are either treated with disdain, they are victimized, doctors who are raising these issues. They feel like their issues are actually not being prioritized or even being acknowledged. For example, as we sit right now, are you aware of any doctors in this tertiary hospital collective that are threatening to resign, that are saying we are highly strained and we've had it, that's enough, we can't continue in this kind of environment?
Thabo, look, we're not hostile to any of our workforce. Personally, I'm very sweet. There are many people who are going to call you and agree with me. We are not hostile to anybody, and we are very open, Thabo. A constrained health system has got effects. It's frustrating to management. It's frustrating to our leadership. It's also frustrating to the doctors. Certainly, ours as management is definitely to embrace and to listen to them. Sometimes we don't have immediate solutions as they would desire. But we have open door policy. We listen to them. And we, at all times, we appreciate what they do. We're talking about doctors who are actually not just like me or looking at strategies. They are touching patients under very difficult circumstances. So we always really embrace them and their input and also understand their frustration at times. But certainly, it's not on the verge of collapse. We are not people who are harsh to anybody or hostile to anyone. But obviously, in a constrained environment, there are different degrees of resistance. There are people who probably may break sooner than others, and we don't want anyone to break here. Yeah. So ours is to make sure we look after them and we support them under the very difficult circumstances. These are my stars. These are the people who make me give 5-star service to my patients. Yeah. So definitely not hostile, Tabo. I need them more than they need me. And the public needs them more than they need them. So those are people that we really love and we appreciate what they do.
So the claim that you are having a shortage of neurologists, for example, are you saying that is completely unfounded?
No, Tabo, it's not completely unfounded. I had 2 urologists when in fact I need 8. So now I have 2 again because one of them resigned and relocated. The other one who resigned also rejoined the service. And I extended the contract of another one. So having 2 even before this kind of problems was not enough. Because the demand for my drainage area is for 8 urologists, which I am training. Others are about to qualify. The key thing will be retention. So definitely, not because of resignation of one urologist and then we have a disaster or a verge of collapse. No. People do come and people do go from the public health system. Others do come back from private, back to public health system. So it's an ongoing thing. I mean, and it's a resignation of 1 or 2 doctors, unfortunately, out of 444 doctors, is certainly not an indication of collapse. I have 444 doctors in my system.
Dr.
Out of 490 posts, so I'm only short of 44.
Let's leave it there. Much appreciated, and thank you for your time. That was the Eastern Cape Health Medical Services Director, Dr. Mtandeki Xamlashe. They're saying it's far from a crisis, but there are constraints, certainly, that they are dealing with.